Hi everyone, welcome back to the Pill to Know channel. Today we're diving into the prevention and treatment of type 2 diabetes, the most common form of diabetes. Whether you're here to learn for yourself, a loved one, or just stay informed, you're in the right place. So grab a cup of tea, get comfortable, and let's break it all down, simply, clearly, and with your health in mind. Before we begin, a quick but important reminder. This video is for educational purposes only. To stay unbiased, we'll be using generic drug names throughout. If you're considering any changes to your medications or treatment plan, please talk to your healthcare provider first. Your health is unique, your care should be too. Prevention of type 2 diabetes. Let's start with prevention. If you have prediabetes, there are powerful steps you can take to reduce your risk of developing type 2 diabetes. First, monitoring. If you've been diagnosed with prediabetes, it's important to have regular follow-ups, at least once a year, to monitor for progression to diabetes. 2. Lifestyle changes, the foundation of prevention. Weight loss. Weight loss makes a big difference. In fact, every 1 kilogram, 2.2 pounds, lost reduces the risk of diabetes by 16% over 3.2 years. For those with a history of gestational diabetes, the risk increases by 18% for every 1 point increase in BMI beyond your pre-pregnancy baseline. If you're overweight or obese and at high risk, aim to lose 7% of your starting body weight within 6 months. That's around 1 to 2 pounds per week. This can be achieved through a healthy, reduced-calorie diet and moderate-intensity physical activity. Diet. Evidence-based eating patterns include Mediterranean-style diet, intermittent fasting, low-carbohydrate diets. Choose what fits best with your lifestyle and preferences. Physical activity. Aim for at least 150 minutes per week of moderate-intensity activity. Great options include brisk walking, cycling, water aerobics, dancing, gardening, even daily chores like vacuuming or mowing the lawn. Sleep. Sleep is just as important as diet and exercise. According to the American Diabetes Association and the European Association for the Study of Diabetes, focus on quantity. The sweet spot is 7 to 9 hours per night. Less than 6 or more than 9 hours is associated with up to a 50% increased risk of developing diabetes. Quality. Poor sleep quality is linked to a 40 to 84% increased risk. Timing. Night owls are 2.5 times more likely to develop type 2 diabetes than early risers. So go to bed early. Your body will thank you. Pharmacologic interventions for prevention. Lifestyle changes are the cornerstone, but sometimes medications are added for those at higher risk. Metformin, considered for high-risk individuals, especially. Age 25 to 59 years. BMI greater than or equal to 35 kilograms per square meter. Fasting glucose greater than or equal to 110 milligrams per deciliter. A1C greater than or equal to 6%. Or have a history of gestational diabetes. It has been shown metformin plus intensive lifestyle changes can cut diabetes risk by 50%. Important note, effects wear off after stopping the medication, so long-term use is needed. Long-term use may cause vitamin B12 deficiency. Consider periodic B12 checks, especially in people with anemia or neuropathy. Weight loss medications. Drugs like orlistat, phentermine or topiramate, liraglutide, semaglutide, and tirzepatide have been shown to reduce diabetes risk in those with prediabetes. Pioglitazone. Based on the insulin resistance intervention after stroke, IRIS trial, pioglitazone may be considered to reduce the risk of stroke or heart attack for individuals with a recent history of stroke or transient ischemic attack, evidence of insulin resistance, and prediabetes. Important note. Be cautious. It can cause weight gain, fluid retention, and bone fractures. Lower doses may reduce side effects, but may also be less effective. Pharmacologic therapy for type 2 diabetes. Now let's move to treatment. Here's a simplified overview of common medications used to manage type 2 diabetes, starting with oral options. Oral medications. We'll walk through 5 main classes. 1. Big UA NIDs. Example, Metformin, the only drug in this class. How it works. Metformin lowers blood glucose by decreasing liver glucose production, reducing intestinal glucose absorption, and improving insulin sensitivity, enhancing peripheral glucose uptake and utilization. Glucose-lowering efficacy. High. Hypoglycemia risk. None. Weight effects. Neutral. Possible modest weight loss. Cardiovascular effects. Potential benefit for major cardiovascular events, such as heart attack or stroke. Kidney effects. Neutral. Common side effects. B12 deficiency, GI issues such as diarrhea, abdominal pain, and bloating. Taking with food may help reduce the GI side effects. Second, dipeptidyl peptidase 4, DPP4, inhibitors. Examples: alogliptin, linagliptin, saxagliptin, sitagliptin. Look for the gliptin ending. How they work? DPP4 inhibitors increase levels of incretin hormones, GLP-1 and GIP, which stimulate insulin release and reduce liver glucose production in response to meals. Glucose-lowering efficacy. Intermediate. Hypoglycemia risk. None. Weight effects. Neutral. Cardiovascular effects. Neutral. Kidney effects. Neutral. Common side effects. Pancreatitis, joint pain. 3. Sodium glucose cotransporter 2 SGLT2 inhibitors. Examples: canagliflozin, dapagliflozin, empagliflozin, ertugliflozin, all ending in gliflozin. How they work. SGLT2 inhibitors block glucose reabsorption in the kidneys, lowering the threshold for glucose excretion and increasing its elimination through urine. Glucose-lowering efficacy. Intermediate to high. Hypoglycemia risk. None. Weight effects. Moderate loss. Cardiovascular effects. Benefit for major cardiovascular events and heart failure. Kidney effects. Beneficial. Common side effects. Increased risk of genital yeast infections, urinary tract infections, and diabetic ketoacidosis. 4. Sulfonylureas. Second generation. Examples: glympyride, glipizide, glyburide. Note: first-generation sulfonylureas are rarely used due to lower potency and higher cardiovascular risk. How they work? These drugs stimulate insulin release by enhancing pancreatic beta cell activity, reduce glucose output from the liver, and improve insulin sensitivity at peripheral target sites. Glucose-lowering efficacy. High. Hypoglycemia risk? Yes. Weight effects. Gain. Cardiovascular effects. Neutral. Kidney effects? Neutral. Common side effects. Hypoglycemia, especially when combined with insulin. 5. Thiazolidinedione, TZDs. Examples: pioglitazone, rosiglitazone, glitazones, suffix. How they work. TZDs reduce insulin resistance in the liver and peripheral tissues, increasing insulin-dependent glucose uptake and decreasing hepatic glucose output. Glucose-lowering efficacy. High. Hypoglycemia risk. None. Weight effects. Gain. Cardiovascular effects. Potential benefit on major events, but increased risk of heart failure. Kidney effects. Neutral. Common side effects: fluid retention, heart failure, bone fractures. Warning: avoid in patients with symptomatic heart failure or active bladder cancer. Injectable therapies. Now let's look at 3 injectable categories. 1. Glucagon-like peptide, 1 receptor agonists, GLP-1 RAs. Examples: dulaglutide, exenatide, liraglutide, lixisenatide, semaglutide. Note: semaglutide is also available in oral form. How they work. These agents stimulate insulin secretion and suppress glucagon secretion in a glucose-dependent manner, while also slowing gastric emptying to reduce post-meal glucose spikes. Glucose-lowering efficacy. High to very high. Hypoglycemia risk. None. Weight effects. Moderate to significant loss. Cardiovascular effects. Benefit for major cardiovascular events. Neutral for heart failure. Kidney effects. Beneficial. Common side effects. Gastrointestinal discomfort. Risk of pancreatitis. Warning: Not recommended for individuals with a personal family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2. 2. Dual glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide 1 receptor agonists, GLP-1 RAs. Example, tirzepatide. How it works: combines effects of both GIP and GLP-1 to enhance insulin release and reduce glucagon levels in a glucose-dependent manner. Glucose-lowering efficacy, very high. Hypoglycemia risk, none. Weight effects, significant weight loss. Cardiovascular effects, under investigation. Kidney effects, under investigation. Common side effects, gastrointestinal discomfort, risk of pancreatitis. Warning, same precautions as with GLP-1 RAs regarding thyroid cancer history. Third, insulin therapy. Examples, basal and prandial insulin, also available in inhaled form. Basal insulin mimics background insulin secretion. Prandial insulin covers blood sugar spikes after meals. How it works: replaces or supplements natural insulin to promote glucose uptake in peripheral tissues, such as skeletal muscle and fat, and inhibit glucose production in the liver. Glucose-lowering efficacy, high to very high. Hypoglycemia risk, yes. Weight effects, gain. Cardiovascular effects, neutral. Kidney effects, neutral. Common side effects, high risk of hypoglycemia, especially in those with impaired kidney function. We know this is a lot to take in, so here are some key points to remember. Personalization is key. Your glucose-lowering therapy should be tailored based on your health conditions, risks, like hypoglycemia, lifestyle, access to medications, and personal preferences. Monitor regularly. Reassess your treatment plan every 3 to 6 months to avoid therapeutic inertia. Lifestyle matters. Nutrition, physical activity, and weight management should always be part of the plan, even when medications are involved. Talk to your provider. Always consult your healthcare team before starting, changing, or stopping any medication. If you're seeing multiple specialists, make sure each knows what others are prescribing. Some drugs can affect blood sugar and may require adjusting your diabetes meds. If you found this video helpful, please like, share, and subscribe to stay connected and support the Pill2Know community. I'll include references in the description. Have questions? Drop them in the comments. I'd love to hear from you. Until next time, let's stay healthy with Pill2Know.